Hello students, this is Perio, Chapter 21, Lecture 1. Nutritional Influence on Periodontal Health. Periodontal disease is an inflammatory response to bacterial plaque biofilm. Periodontal disease cannot be caused by nutritional deficiencies. However, some nutritional deficiencies may affect the severity and extent of periodontal disease. Nutritional deficiencies that can increase the risk for periodontal disease include vitamin D and calcium deficiencies. Vitamin D is fat-soluble and regulates plasma calcium levels. It helps the host's defense against infection. Deficiencies result in bone loss and increased inflammation. Vitamin D is found in egg yolks, liver, and oily fish such as salmon. It is mainly produced within the skin in response to sunlight. Calcium is found in dairy products. Vitamin C is a water-soluble vitamin. There is a small link between vitamin C deficiency and periodontal disease. There's a small link between vitamin C deficiency and attachment loss. The human body is dependent on dietary sources to meet vitamin C needs. Vitamin C is found in citrus fruits, berries, tomatoes, and leafy greens. Scurvy is a disease caused by prolonged deprivation of vitamin C. The medical manifestations of scurvy are poor wound healing, progressive anemia, muscle pain, internal bleeding, and musculoskeletal problems in children. The dental manifestations of scurvy are excessive gingival bleeding and swelling, periodontal ligament destruction, alveolar bone destruction, tooth mobility, and tooth loss. Scurvy was very common in sailors who explored the New World, such as Christopher Columbus's crew. Ascorbic acid or vitamin C deficiency gingivitis is seen in a 15-month-old, and on the right it shows after the vitamin C deficiency has been cured. Refined carbohydrates. Excessive consumption of refined carbohydrates may affect the immune response. It may cause rapid release of glucose, increase in triglyceride levels, stimulation of insulin, and reduction of the breakdown of fat. Excess fat or lipids in the blood may increase inflammation. Protein deficiency impairs immunity. Kwashiorkor is the name of the disease caused by severe protein deficiency. Kwashiorkor shifts the oral subgingival bacteria to include more periodontal pathogens, and it contributes to a greater incidence of periodontitis. Antioxidants occur naturally in the body and in certain foods. They inhibit the oxidation and block free radical damage to cells. Antioxidants include many enzymes and vitamins such as vitamin A, C, E, and zinc and selenium. Dietary antioxidants may alter the inflammatory process. Omega-3 polyunsaturated fatty acids. A deficiency in these may increase the risk for periodontal disease. These are found in leafy green vegetables, cold water fish, and vegetable oils. They help to reduce serum cholesterol, have anticoagulant properties, and anti-inflammatory effects. Obesity may be a predisposing factor to periodontal disease. High fat, sodium, and refined carbohydrates diets, plus low consumption of nutrient-rich foods, can lead to obesity. It is interesting to note that obesity is increasing in our society, and yet malnutrition is increasing alongside it. Nutrients that build healthy periodontium. Sulcular epithelium has a rapid generation, and they need vitamin A, B, D, calcium, and magnesium for health. The alveolar bone is also necessary for periodontal health, and vitamin D enhances calcium and magnesium absorption. Nutrients that build a healthy immune system. A healthy immune system will help contain bacterial attacks that cause periodontal disease. Vitamin A, B, and C help maintain a healthy immune system. Periodontal infections are similar to a wound in that they must be repaired, they must be allowed time in order to heal, and must have adequate nutrition. Vitamin C, iron, zinc, and copper assist in collagen formation, which helps repair wounds, including periodontium. Protein is a major nutrient that repairs and maintains diseased and injured tissue. Clinicians may make dietary suggestions to patients with periodontal disease to prevent deficiencies as well as maintain periodontal health. If poor nutrition is suspected as a problem, the patient should be encouraged to keep a diet diary. Involving the patient in decisions and choices assures greater compliance and success. Suggestions for maintaining periodontal health and good overall health. The USDA My Pyramid, the USDA Guidelines for Healthy Americans, multivitamins and multiminerals, crunchy foods, inclusion of rich antioxidants, vitamin D, calcium, and omega-3 polyunsaturated fats are all suggestions that are given in your textbook. Steps for nutritional counseling. Review the medical and dental history for physical concerns that may relate to periodontal health. For example, anemia, use of multiple medications, hypertension, diabetes, recurrent decay, angular cheilitis. Instruct the patient to keep a diet diary for several days and analyze the patient-reported diet. Create a personal nutritional profile using the mypyramid.gov website. Compare servings for all food groups with recommendations based on lifestyle. Evaluate frequency of eating crunchy foods. Evaluate inclusion of specific nutrients. Make specific food suggestions. Explain functions of specific nutrients and their impact on maintaining periodontal health. Evaluate frequency of consumption of refined carbohydrates and explain the difference between refined carbohydrates and complex carbohydrates and their effect on periodontal health. Explain the benefits of consuming foods rich in lactic acid and soy. Recap. Nutritional deficiencies do not cause periodontal disease. However, some deficiencies may impact on the severity and extent of periodontal disease. Foods high in refined carbohydrates and nutritional deficiencies may hinder the inflammatory response evident in periodontal disease. A diet diary may be a useful tool in educating patients on dietary nutrients specific to promoting periodontal health, as well as maintaining overall good health. This concludes Perio Chapter 21, Lecture 1.